Welcome, friends. This is Pastor Brian Hudson. I want to invite you to a seminar on mental health and wellness coming up Saturday, March 4th from 11 a.m. to 12:30 p.m. This is being sponsored by New Covenant Church and the Wellness Connection. Our facilitator will be Comishe Nunley, licensed mental health counselor, and she is the owner of the practice Healing Your Hidden Hurts, LLC. For more information and registration, go to our website at newcovenant.org/wellness or scan the QR code there on the screen. This seminar will explore the importance of addressing mental health within faith communities and how it is related to our understanding of God's Word. Through interactive and engaging discussions, we will explore how to support those struggling with mental health challenges within our faith communities and beyond. Don't miss this opportunity to deepen your understanding of this crucial issue and learn how to support those in need. And I'm very pleased to have in this conversation our facilitator, Comishe Nunley. Welcome, Comishe.
Thank you so much, Brian, for having me on today. I'm excited to come and talk with everyone and give them a little preview of what's to come.
Yes, thank you so much. As you know, I'm passionate about mental health awareness and advocacy. I'm not a practitioner, but I'm very passionate as a pastor and as a citizen, as a father and husband, just helping people be well. And I do teach and tell the people, our congregation, that we all understand physical wellness. We go get checkups, we get treatments, we get medications, and somehow we have separated out mental health and mental wellness as if the mind doesn't need what the body needs sometimes. So I thank you for your work and your expertise in this area. So again, thanks for being with us on today. Let me begin by asking this question relevant to our upcoming seminar. Comishe, what are the conditions in our times that make a seminar like this helpful and needed?
Absolutely. Thank you for that question. And I appreciate you bringing me on once again, just to be able to talk about this. But as an African American, I am very well aware, Christian African American, I'm very well aware of the unique challenges that we face in regards to our mental health and wellness. Some contributing factors for why we need to address these things are, systematic racism, discrimination, and other societal factors, which can have a significant impact on our mental well-being. And unfortunately, there's still a rise in stigma associated with seeking help. And so as a result of those things, as well as additionally, COVID-19 pandemic has added to the issues that we are seeing within the faith community and by contrast, mental health struggles and how that has impacted our overall well-being as well because of things like isolation, financial stress, the loss of loved ones, even with pastors having to do insurmountable amounts of funerals per year or per week. That begins to collectively take a toll on our mental health individually and collectively.
It's interesting. I guess the president has announced the end of the public health emergency. We know COVID is still going on. And of course, you were working and serving and yourself surviving COVID. Mm-hmm. And now we're on this side of it. Are you seeing effects? I know we hear about long COVID medically, affects long-term COVID concerns. Are you seeing mental health related issues related to COVID now that we're past the worst of it?
Yeah, so I like to tell people that mental health was a pandemic before COVID came about, but many people don't realize the after effects that COVID has on the psyche. It typically studied in different research articles from past pandemics or natural disasters creates an upheaval in our ability to manage our emotions. And so two of the major risk factors that we notice as a result of COVID-19 or others is a sense of hypervigilance. Addictions go on the rise, and just a constant state of feeling on edge. And so that can lead into many other symptoms and make them escalated as a result of that. And so while COVID-19 may be, no longer considered within a state of emergency, our mental health and well-being in dealing with it is still very much so alarming.
Now, briefly, what is hypervigilance?
Yes. So hypervigilance is when you have a startled response to any one thing because you perceive danger in so many places. So for so long, we had to go somewhere and be a little bit more vigilant about our surroundings. Whereas now it's in the US and we're fearful of the next person. So knowing that COVID-19 is spread by someone, who could sneeze or could talk to you without a mask has created a sense of internalized anxiety and fear that when somebody coughs, automatically everybody kind of clinches, right? And they become startled because they don't know, is this the COVID or do they have a mask on or, and so constantly walking around with that level of fear eventually starts to break us down emotionally.
I'm speaking with Commissioner Nunley, and we are previewing our upcoming seminar entitled Be Informed, Be Well, Mental Health and Wellness Seminar, Saturday, March 4th. I want to ask this next question. In the church world, what are some unhelpful mindsets related to mental health and wellness?
Yeah, in the church community, unfortunately, there still are some misunderstandings and what I call unhealthy faith perspectives surrounding mental health and wellness. And so some people believe that mental health is a sign of weakness, a sign of not having a strong prayer life, not believing on God enough for a thing. And so they kind of reject the idea sometimes of mental health actually being an issue either genetically or epigenetically, environmentally, or biologically. And so this is just simply not true. And it's important that we understand that seeking mental help is just as important as if you were to seek medical help for any one injury that you have. So we have to be willing to lay these unhealthy faith perspectives surrounding mental health down. Otherwise, we're going to continue to, just be crushed under the weight of the environmental factors that are happening around us.
I've heard it said more than once, all you need is Jesus. I've heard that. And
I've contrastly heard you can have Jesus and a therapist.
Well, my response is faith without works is dead.
Yes.
Okay. Mm-hmm. And really in COVID, we found that faith without works means literally dead. Okay. Mm-hmm. Without masks and vaccinations. So I'm here obviously as a pastor and having you on, sending the message out that the Lord has sent people, sent into our lives to help us. So what should we expect to learn and take away from this upcoming seminar on mental health and wellness?
Well, we can expect to learn more about the specific challenges within our church communities, within the African American communities facing regarding mental health, and then different strategies for improving the overall attitudes towards mental health will be discussed, as well as having myself provide some valuable resources and insights for those who might be struggling. My hope is that it is a very interactive discussion that we can have between everyone so that we can walk away feeling like we have something that we can put into practice once we walk away. So.
All right, let me ask Ms. Nunley, if you have anything you want to add to our conversation and share with the audience before we conclude this conversation.
Sure. I just want everybody to remember that mental health struggles are real, and it is okay if you seek out mental health counseling, that it's not a sign of weakness, but rather an opportunity for you to grow, to heal, and to really get clarity on where you are in your life so that you can live up to your purpose and provide meaning in your life.
Well, thank you so much. I've been speaking with Commissioner Nunley, who is our facilitator at the upcoming Mental Health and Wellness Seminar at New Covenant Church. Details on your screen there. Want you to register. There's no cost. 11 a.m. to 12:30 p.m. And I'm pretty good with doing things on time, both beginning and ending on time, okay? So we got plans on Saturday. You won't be locked in with us, all right, beyond 12:30, okay? So come on out, be a part in person and online. Now, the online portion won't be interactive. So I want you to, come in person, if you would, please, to be able to ask the questions, interact with us in person. But if you can't come, you can watch online and benefit that way. So, Ms. Nunley, thank you so much for being with me here on today.
Absolutely. Thank you.
Again, thank you for joining us for this brief conversation, a preview of the upcoming seminar, Be Informed, Be Well, Mental Health and Wellness Seminar at New Covenant Church, Saturday, March the 4th. And again, it's being sponsored by the Wellness Connection and New Covenant Church. So please join us. I believe, I'm sure you'll be helped at some level or another. So thank you so much for being with us, and we'll see you soon.